Oh, my name is Yungl Ing. Today I would like to talk about monitoring of ovarian disease and cancer by using serum CA and CA125. Endometriosis is an ovarian disease that's present of endometrial-like cell in the pelvic cavity. Endometriosis not only grow in the pelvic cavity but also in the pleura, pericardium, and central nervous system. CA125 has a typical specificity and sensitivity of 63 to 81% and 81 to 90% of diagnosing women with ultrasound negative endometriosis during the menstrual phase. Ovarian cancer has been classified into distinct histological subtypes, each with its own set of risk factor, origin, cell, molecular composition, clinical characteristics, and treatment. Many factors can cause or contribute to ovarian cancer. Family history is the most common type. The most significant risk factor of ovarian cancer is the family history of breast and ovarian cancer. A personal history of breast cancer linked to an increase of ovarian cancer. Tumor markers are the biomarkers that enable us to rule out the possibility of disease and cancer in the linked organs by using specific cancer markers such as CA125 and CS. CA125, also known as cancer antigen 125. The CA125 blood test determines the level of CA125 in the bloodstream. The CA125 level indicates the others ovarian disease such as endometriosis or likely cancerous. The specificity and sensitivity of CA125 detection in early stage of ovarian cancer are low. It can be used to track the progress and regression of ovarian cancer after surgery and chemotherapy. In postmenopausal women, CA125 had higher and more stable sensitivity and specificity than the premenopausal woman. CA or carcinoembryonic antigen is a protein found in the tissue of a growing baby. However, the level of CA frequently decreases or disappears after delivery. CA is a cancer or illness diagnosis test. However, gynecology typical order the CA in addition to the CA125. CA and CA125 both perform similar function. So going to our objective. The general objective to elevate the serum CA125 and serum CA level in ovarian disease and ovarian cancer. The specific objective is to measure the serum CA125 and CA in endometriosis, to measure the serum CA125 and CA level in ovarian cancer, also to compare the serum CA125 and CA in ovarian disease group and ovarian cancer group. We are going to the methodology. The 100 samples are collected in the serum separator tube and run until torso AIA 36. The result will be out in 24 to 36 hours. The data will be tabulated in the computer, and then the result will be calculated by the SPSS. So in the 100 sample, there are 75 of endometriosis cases and 25 of ovarian cancer cases. All the 100 samples are done by the torso AIA, the 360 machine. The tests are using before and after to see the change of monitoring. The before are collected from the patient medical record which have not started any treatment, while for the after we are collected 2 rounds of the blood sample which is after 6 months and a year. The results are paired in before with 6 months and 6 months after a year. Both results of endometriosis and ovarian cancer show significant with p-value less than 0.5. We are going to the result. Now we are going to the result and discussion. So in the study, 100 samples are collected with total 75 of endometriosis cases and the rest of ovarian cancer cases. From the data provided, the p-value of paired tests of the serum CA125 and serum CA to both cases are significant with less than 0.01 shown in Figure 1 and Figure 2. Serum CA125 and serum CA are used to compare the monitoring of endometriosis and ovarian cancer in 6 months and a year after treatment to monitor the rate of recurrence of and disease control. After 6 months and a year, the p-value of the serum CA125 and serum CA are significant less than 0.01 in ovarian cancers and endometriosis. Moreover, the detection of abnormality are difficult in ovary compared with cervix, because of the ovary is inside of the body, and the ovary because of the cervix is outside of not outside, is near the out near is is the cervix have the thin prep test, which is easier for in screening and for detection. But ovary is inside of our body and is quite deep. We are difficult to feel the lumps if any changes. So in this research, more focus on the monitoring the viability and stability of the serum CA125 and CA. In endometriosis, majority are using contraceptive pill or hormone modulator to control it. The only management of the ovarian cancer was undergoing surgery once diagnosed. We are monitoring the rate of recurrence in ovarian cancer due to the status of menstruation of patient are postmenopausal. There were no hormone changes in ovarian cancer cases. Besides that, if the patient increased serum CA125 and CA is one of the signs might recurrent in ovarian cancer or other related disease. Postmenopausal women are more sensitive and specificity in serum CA125. So now we are going for the figure 1, which is monitoring of endometriosis after management, and figure 2 is monitoring of ovarian cancer after management. From the both sides, you can see the label B, A6 and A1. B is stand for before, A6 is after 6 months, A1 is after a year. We can know that the p-value provided here are less than 0.01, which means our result is significant and there are changes in monitoring. Changes of the value in monitoring, which means it is functioning in monitoring by using CA125 and CA in ovarian disease and cancer. Now we are going for our conclusion. To conclude, there is no significant result in monitoring of endometriosis and ovarian cancer by using serum CA125 and CA. We could not guarantee or fully support the term of serum CA125 and CA is reliable in monitoring due to the sample sizes for research is 100 that also combines 37 cases of endometriosis and 25 cases of ovarian cancer. It can have a bigger size of sample might strongly support on it. One of the limitations in the study is the serum CA125 and CA are proportionally affected by the hormone changes. If the patient did the test during ovulation and menstruation, the result will be increased. It will be one of the criteria affect the result. Many studies have shown the serum CA125 perform well when combined with other biomarkers such as CA, CA19-9, and HE4, increasing the sensitivity and specificity in monitoring and diagnosis of ovarian cancer, which have a poor prognosis is usually detected. So it can increase the sensitivity because during here, which is a poor prognosis and is usually detected at an advanced stages, means that if let's say we are run the CA125 singly, so we are difficult to get because of the less of the sensitivity and specificity, so we couldn't get the confirmation or not confirmation or the suspecting in the earlier stages. So this value has demonstrated the remarkable ability to differentiate between the epithelial ovarian cancer and benign ovarian tumor. When used in premenopausal and postmenopausal women, the ROMA sensitivity and specificity is 88% and approximately 37%. I would like to thank my supervisor and employer, Puan Asma Harun, and Dr. Wong Wai Ping give all the guidance and knowledge to done my research. Also my fellow friend of MLS13 which always motivate and teach me when I face the problem in my research. Lastly, I would take the opportunity to thank all the people who accompany me in the journey of research.